Return to Campus webinar for staff. My name is Winifred Williams, and I am the Vice President for Human Resources and the Chief Diversity and Inclusion Officer for Loyola University Chicago. I will serve as your moderator for today's session. Thank you very much for making time in your schedule to join us for the webinar today. We are excited to report that we have more than 700 participants registered for this event, representing staff from all of our Chicago area campuses. During today's webinar, we will address helpful topics for staff as you return to campus next week. Yes, after 15 plus months, we're transitioning to being fully on campus starting Monday, August the 2nd. Some have asked the question why. The university is resuming full campus operations to provide our students with the Loyola experience they've told us that they want from both our people and our institution. This afternoon, you'll hear about processes, procedures, policies, protocols, and resources that are available to facilitate a smooth transition back to campus for our Loyola community members. We'll discuss a variety of topics, ranging from safety and health protocols to setting up workstations and related logistics. I will share some information from Human Resources, and we also have representatives from the Wellness Center, facilities, and Information Services Technology to give you a sense of what to expect and to answer your questions. So with that, please join me in welcoming our panelists for today's session. First is Dr. David DeBoer, the Director of Counseling at the Wellness Center. Our next panelist will be Kana Henning. Kana is the Senior Associate Vice President for Facilities and also serves as the Section Chief for Campus Continuity. Dan Vonderheide is the Associate Vice President for Information Technology Services. As in previous webinars, Q&A will follow each speaker. We have collated questions that you've submitted during the registration process and those that you're asking today. We'll direct those questions to one of our expert panelists or to a team of staff volunteers behind the scenes. Please understand that these volunteers will answer your questions as fast as they can. However, if we don't get to your question, please submit it using the Q&A function at the bottom of the Zoom platform during the webinar. You may email COVID-19 support@luc.edu anytime and check the Return to Campus website for ongoing updates. We expect to conclude about 4:30 this afternoon. And at this time, I would like to transition into the HR segment of today's session. We have all persevered over the past several months working in the pandemic. The changes and challenges that have been faced by all will inevitably impact the workplace starting in fall of 2021 and into the future. Suffice it to say, our fall of 2021 will be unlike 2020 and also unlike 2019 as well. Simply put, things have changed. As a community, we're faced with new workplace dynamics, and as a result of your adaptability, your flexibility, your patience and commitment, all of those things will enable success for the university. Given the changing dynamics that are resulting from the pandemic, the university wants to be responsive by exercising flexibility on a trial basis to enable a smooth transition back to campus. Our remote work experience resulted from the emergent situation that faced the world. As society reopens and regains focus on their core business, Loyola stands ready to resume our charge as well. As we return to campus, it is incumbent upon each of us to keep the mission of the university at the forefront of our thoughts and our actions. Our mission remains to serve our students and support our staff and faculty, in addition to our community partners. And to enable this transition, the university will adopt some primary work modalities for staff But again, it's on a trial basis during the fall semester. Feedback and input provided to support these work modalities was provided through various community voices to include, but not limited to, the Constituency Engagement Work Group for Staff, the Return to Campus Staff Advisory Work Group, University Staff Council, the Provost Office, our deans, and the President's Cabinet, in addition to points of feedback from various other members of the Loyola community. So in an effort to be responsive to these changing dynamics in the workplace while maintaining focus on our core mission, our trial work modes for the fall will include an on-campus option, hybrid, and remote work structures. Each staff member should have been notified of your fall semester work mode within your department from your department leadership. If not, please reach out to them so that you can secure that guidance. From a process perspective, how did we get here? Each department had the agency to evaluate the feasibility of adopting 3 different work modes for staff during this trial period. Those again were on campus, hybrid, meaning working on campus a minimum of 3 days each week and working off campus for 2 days each week, along with a possible remote option. However, it is important to note that some departments, based on the services that they provide and or how they interface with students and other members of the Loyola community, may be unable to accommodate more than one work mode beyond being on campus. And that's due to the nature of the work that they're performing. But please speak with your department manager and or your human resources manager if you have questions that are specific to your work area related to the work mode designation and any accommodations that may be needed. On campus generally refers to those roles primarily providing or supporting student-facing and direct student and or public contact or campus-related support services. And on-campus physical presence will be looked to and expected 5 days a week. The hybrid model combines the elements of a campus presence with remote work. Some staff members, by the nature of their individual job responsibilities and the needs of their department and the university, will work some days on campus and some days from a remote location. Hybrid positions will be expected to work at least 3 days each week on campus and work remotely for the balance of that time. When we use the term remote, we're referring to employees whose work primarily takes place off campus based on their individual job responsibilities, the needs and expectations of their department to fulfill their department's commitments to the university, along with meeting the needs of the university and how we support students and our community as a whole. They will, however, be expected to have a periodic presence on campus, which will be determined by their department management to support departmental working initiatives to facilitate communication, in addition to fostering teamwork and collegiality. Preserving a sense of community and fellowship is paramount to our culture. The university believes that this is essential for teams to come together on a regular basis, to connect in person, to build community, to enjoy opportunities for the social and spontaneous aspects of work, to strengthen our teams, and to collaborate in ways that are not as easy when we're in a virtual mode. Given the different work modalities, department leaders will want to develop structures to bring their teams back together in the workplace on a periodic basis. However, that flexibility will be managed at the school, the college, or the administrative unit level, and will be based on the dynamics of those respective teams, taking into consideration the size of those teams and that staff and the work that they're engaged on. Our trial structure of work is a part of the university's commitment to adapt to change and to increase staff satisfaction, retention, recruitment, and productivity. So how were designations determined? Well, in preparation for the return to campus, university managers and leaders engaged in a thoughtful assessment process. An assessment process which included developing staffing plans for their areas of managerial responsibility, determination of eligibility to work on campus, hybrid or remote, was based on an assessment of the individual job function and requirements. It also included an assessment of the goals and performance objectives for individual departments, in addition to the business goals and operating needs of the university. University Staff Council has submitted a question, which I'll go ahead and respond to in this segment, because it is certainly of a related nature. The question posed by University Staff Council says, in many areas, being remote for over a year and a half has proven to be successful with no interruptions to services to students and has not prevented students from having access to staff. With that being said, why is there a hesitation for staff to have more flexibility to work remotely, especially when having such flexibility leads to healthier and happier staff? Well, to put things in context, the pandemic event of 2020 caught everyone by surprise. It resulted in a state of emergency, not only for Loyola, but also for the entire United States and around the globe as well. That emergent event required an emergency response in which all forms of work and life interactions were remanded to work in remote structures. Our faculty, staff, and students were guided away from campus and required to adopt new systems for engaging in work and life activities. And quite frankly, as Loyolans, we're to be commended for the degree of flexibility, adaptability, cooperation, and patience that we have each demonstrated through this challenging period in history. However, it is important to note that the emergency situation that previously faced us has transformed into a more manageable dynamic, especially with the introduction of COVID testing and now 3 COVID vaccines on the market, along with ongoing social distancing and masking discipline. So the emergency conditions under which we worked for the past 15 plus months provided the only available option at that time. While workable, it may not necessarily be the most effective approach to servicing the university's mission in the manner in which Loyola strives to deliver its transformational learning experience. Our conditions have changed now. The world in general is resuming a more normal state of activity. Our campuses are reopening, our students will be back, and our activities will start up again. So for Loyola, that means being here, being present, as we each committed when we chose to work here and accepted employment at Loyola. Accepted to be a part of a community to help carry out the work of the university. Our education proposition is predicated on strong and frequent personal interaction and fellowship. As a result, we will enthusiastically welcome back our full complement of students onto our campuses in just a few weeks. Faculty and staff are integral to the success of this educational model, which has a people-centered activity at its core. The decision to accommodate the 3 work modalities as a trial in the fall was indeed an effort on the part of the university leadership to embrace the change that we find ourselves in and to provide modified work schedules to support and to balance employee satisfaction with the needs of the university, which do remain the same. Another question posed by University Staff Council was, why is it that individuals who have the same work responsibilities or the same job title, but have different reporting lines, have different work from home options? Well, as I mentioned, staffing plans have been developed, and they were developed based on job requirements versus personal requirements and personal preferences. Some differences between units and sometimes even within units regarding work modes for staff is to be expected. It's not a one-size-fits-all approach. And it's also important to remember that this is a short-term trial period. This isn't the long-term structure. This is a process to help us transition back to campus from having been away for 15 plus months and taking an opportunity to assess to see what works, what doesn't work, what do we need to stop doing, and how can we adopt a work mode for the future. And we call that a longer term working structure. Differences in work mode assignment will be due primarily to factors such as the size of the teams, the nature of the work that's performed by those teams, and work performed by the individuals. This type of flexibility is needed to enable the departments to make staffing decisions that will allow them to meet their departmental deliverables. And as I mentioned earlier, specific questions about work mode designations within departments, I'll ask you to follow up with your department management or to reach out to your human resources manager for further assistance and clarification. Again, these structures, they're for a limited period and should not be considered a long-term model. During the fall semester, the university community will be asked for feedback and input related to the aspects and our experiences of working in these three modes over the next few months. And that will serve as the basis and the foundation for establishing a longer-term model for work at Loyola into the future. It's also important to keep in mind that factors surrounding the pandemic change quite frequently. So please know that the best of plans may require some modification in response to those changes. This is where we will really need your flexibility and your cooperation. Before I switch to the next panelist, I would like to just provide you some highlight information from our recent staff survey. Thank you to all of you who participated in the survey. And please know that the survey was actually inspired by several of our staff groups, which included our constituency engagement work group for staff, the staff return to campus advisory work group, and University Staff Council. The survey results reveal very promising highlights, which reflect well on the decisions made by university leadership. For example, when asked how comfortable staff feel returning to work on campus next month, more than half, 56% actually, of staff said they were very comfortable or somewhat comfortable. 73% of staff surveyed said that given the mitigation efforts and safety protocols in place, they strongly agree with the following statement. I feel protected from health and safety hazards performing my job in person. I am confident that my organization will take appropriate measures to keep me as safe as possible when I return to work on campus. And one final highlight, which speaks to staff motivation for returning to campus. 64% of our participants cited the opportunity for personal interactions with coworkers and/or students, fostering teamwork, and engaging in activities that promote a collegiate experience for our students as the top reasons for returning to campus. The health and safety of our entire community is paramount. As you know, all students are required to be vaccinated unless they have an approved exemption. As of today, 90% of faculty and staff are actually vaccinated, which is a great demonstration of community effort. However, I do want to highlight today's university-wide communication, which states that the COVID vaccine is now required for all faculty and staff at Loyola University Chicago. This is being adopted to reduce the spread of the virus while simultaneously creating and promoting a healthy campus experience for everyone. Faculty and staff are to receive a COVID-19 vaccine by Tuesday, September 21st. And today's announcement aligns with new higher education guidance that has been released from the Illinois Board of Higher Education and the Illinois Community College Board. Alternatively, if you seek and need a qualified medical or religious exemption, requests must be submitted by Friday, August the 13th for review and follow-up. And they will be followed up based on university policy and/or regulatory laws. Additional information regarding the exemption process is available on the Human Resources website. Please be mindful and respectful of the fact that health and safety guidelines within our campus communities are extremely important. Given the high vaccination rates and your attentiveness to the Loyola community's health and safety, your presence on campus is very important. In-person interactions, our collegiality and our spirit to contribute to on-campus culture. People like each one of us make all of that happen. And that's why we look forward to being back on campus. We have so much to look forward to, seeing each other real time in life, participating in our upcoming new student convocation, and welcoming 50% of our students who are new to the campus. Oh, and did I mention we are welcoming the largest freshman class in the history of the university? All of these upcoming events are made possible by the dedicated staff like you. And as I've said, returning to campus is another transition in our change process. It is change management at its very core. Please know that we are here to support our students and each other. And with regard to resources, the university's Employee Assistance Program resources are available to you and your family members at no cost, providing assistance as you need. Information on these and other resources that are available may be accessed through the Human Resources website. On behalf of university leadership, thank you very much for your commitment and your hard work over the past 15 months during these extremely challenging times, which has helped to allow the university to reach some milestones and welcome our community back to our campus home. At this time, I would now like to welcome our first panelist, Dr. David DeBoer. David?
Thanks, Winifred. We've all experienced many changes during the last 15 months or so, and as we transition fully back to campus, we can expect even more changes. I'm just going to offer a few points regarding caring for students, staff, and some general thoughts and suggestions for all of us. As Winifred mentioned, we are essentially welcoming not one, but two incoming classes to campus this fall. Our students are coming to campus because they've told us they want an in-person experience. So we can expect that all of the work we do in supporting new students in transitioning to campus will be magnified in the coming year. In addition, as our students reemerge from the cocoon of quarantine, one of the things we are keeping our eyes out for are increases in anxiety, especially social anxiety. The isolation bubble may have made social skills rusty, and indeed this will be a big adjustment for everyone, staff and students alike. Let's talk about caring for our students. The Wellness Center counseling staff, our whole staff will be back fully in person for staffing, and the counseling staff will be providing services both remotely and in person based on situation and circumstances. We'll be open Monday through Friday from 8:30 to 5. As always, students in an acute mental health crisis can continue to reach out after hours by calling us at 773-508-2530, pressing option 3. Please check our website out for more information so you're prepared with the information you'll need to help get students to care. You can find out about our groups, our medical and health promotion services, resources for underrepresented students, and how to follow us on social media. For students at the Health Sciences campus, Perspectives, the EAP, will also be on site and offering either in-person or remote counseling services as well. If you see a student who you think may be having a hard time, please let them know about our health and counseling resources and help them find their way to us. I also want to say a few words about caring for ourselves, our staff, and each other. None of us can pour from an empty pitcher. In order to care for our students, we all need to care for ourselves first. With the return to working on campus full-time, many of you are about to undergo a major change in your daily life and routine, something we know impacts not just you, but your family and loved ones as well. Even positive change can be disorienting and disruptive. We hope that all of our faculty and staff will continue to make use of their personal resources available to support your own self-care plan. We all have different needs and you know yourself best. Please do be aware of Perspectives, the EAP. It's a Loyola benefit offered at no charge to staff. I encourage you to use it as you need. Reconnecting with colleagues in person or even in a hybrid format may feel awkward at first, and that's okay. I think of the scuba diver who emerges from a deep dive gradually so as not to get the bends. Take your time, give yourselves and each other grace, patience, flexibility, and above all, empathy. This is new territory for all of us. As always, respecting everyone in our campus community is essential. Some colleagues may choose to wear masks and feel more comfortable wearing one. Some may greet you with a hug or an elbow bump. Regardless, we are all easing back and making transitions. Our campus is a microcosm of our society, includes all of the diverse experiences and perspectives as we see in society at large. This gives us the opportunity to build a culture and to model mutual self-respect. You can help by respecting how your colleagues are choosing to return to campus. Also, please remember as staff members that you are our eyes and our ears. It's important not only to know how and where to refer students who are distressed, but that you also know how to notify the Dean of Students through the Center for Student Assistance and Advocacy if you become aware that students are not adhering to health and safety protocols or are behaving disrespectfully or aggressively to members of our campus community. I want to talk a few minutes now more about change. Throughout the pandemic, the one constant has been change, and this fall is going to be no exception. We encourage all of you to expect more of it. For example, you've probably been following news about the Delta variant. Please know that we are watching this very closely. Our healthcare advisory working group is comprised of the university's public health experts and wellness center professionals. This group is continuing to monitor the ongoing situation and advise the university on its decisions and policies regarding the coronavirus, including the recent CDC and IDPH recommendations about indoor masking. The university has been adhering to the Chicago Department of Public Health guidance on matters such as this, and this guidance does not suggest any changes in current policies for our area. We will continue to monitor and provide regular updates through the university's ongoing regular channels. The best thing you can do is to familiarize yourself with the Return to Campus website. I'm going to quote an excerpt from the current statement on that Return to Campus website. Our mask policy is under review as we plan for the next phase of our return to campus. Consider new guidance from the CDC and acknowledge COVID-19 variant concerns amid the increasing but not yet substantial or high levels of transmission in Chicago. But whatever the masking requirements are, please know that getting vaccinated and wearing a mask remain the best mitigation measures you can take to protect yourself and your family, and that the personal choice to wear a mask should always be respected. Now I believe Winifred may have some of your questions for me.
Thank you very much, David. We certainly do appreciate that. Everyone has seen some communication point or another, and hopefully have participated in the vaccine card upload process. So with regard to a question that has come in, several of them on this topic, David, would you be able to share with us how we are authenticating the
Sure. The short answer is we're doing it as best we can. Our medical staff review each and every vaccination record, and they investigate by following up with a student and at times with agency if there are seeming irregularities in the records we receive.
Great, thank you very much. And given the fact that we are looking at a campus community of vaccinated individuals, how are we screening visitors who will be coming to campus?
So, right, it's a great question, and we're not screening visitors in any systemic way. We are operating on the same honor system you will see at public establishments and stores, that we have signage that will be requesting unvaccinated individuals to wear masks, and we are relying on that.
Great, thank you very much. We've received additional questions around surveillance testing for the fall. Will there be surveillance testing in the fall?
Those of you who have been on campus have seen the testing sites. Those of you who haven't been will see them shortly. Surveillance testing will continue to be mandatory for unvaccinated individuals. So students who do receive, or community students, faculty, or staff who receive a religious or a medical exemption will be required to do surveillance testing. If you are vaccinated but I still would like to participate and find your status and get tested, that's going to be available. It just won't be required for you. If you haven't done so already, please do follow the instructions on the Return to Campus website section and on how to establish your testing account through our electronic medical record system. So that'll be a smooth process when you do return to campus, if you're someone who will be using the testing system.
Great, thank you very much. It's very informative and very helpful. We appreciate it. Now I would like to welcome Kana Henning, who will provide an update on campus facilities. Kana, I'll turn it over to you.
Thanks, Margaret. I'm sorry, thanks, Winifred. Thank you, and I want to echo a couple of themes that David shared. We all should expect and experience change. Empathy and patience will help us return fully to campus. And I want to start by thanking the entire facilities team, all of whom have been working throughout the pandemic to ensure that when our university community was ready to return fully to campus, that our campuses would be ready for them. So because of their work, including weekly testing of water, monitoring our ventilation rates, and increasing our air filtration strength, transitioning back to campus should be fairly seamless. All of the latest information about the university's health safety guidelines and protocols can be found on our Return to Campus website that's been added to the chat box. We are still developing some of our guidance for the fall semester, so I do encourage everyone to visit that website for the most up-to-date information. The model that was developed for the Return to Campus grid was done so in phases, so it allows for movement backward and forward as public health conditions dictate. I want to just speak a few moments about other mitigation measures that we have in place. As David mentioned, we continue to study and monitor surges in the community, and we rely on guidance from the CDC, IDPH, CDPH, and our local public health and medical experts for changes to policies such as mask wearing. As a personal safety practice, we support the decision of anyone who chooses to wear a mask on campus. Each department has been provided with a supply of sanitizing wipes and hand sanitizer. So when you return to your workplace, you'll see this supply within your department's suite, office suite, and we encourage that all members of the community should wipe down surfaces that are common spaces, such as touchdown workstations or conference rooms or other shared spaces. So if you're sharing a space like that, please wipe it down in between use. And if you need additional sanitizing supplies, please submit a work ticket with facilities. Housekeeping will continue its normal cleaning routine, cleaning common shared spaces once a day per CDC guidelines. And they're also prepared to disinfect spaces that are impacted by a positive case if that's needed. Some staff have asked about plexiglass in the workplace. And while the use of plexiglass is not supported by science, we do know that the best defense against the virus is vaccination, and that the second best defense is wearing a mask. Given the university-wide vaccine mandate and other more meaningful mitigation measures like ventilation and masking, the benefit of using plexiglass on campus is currently under review. We will continue to display signage around campus, reminding people to stay home if they're sick or exhibiting symptoms of COVID-19, to wash your hands frequently, and to wear your Loyola ID visibly. So when you're in the workplace, you will find it as you left it. Offices and workspaces have been cleaned to get ready for everyone's return to campus next week. Staff who were hired during the pandemic may be coming to campus for the first time. So administrators will need to make sure that any new employee is added to your access list that's maintained by campus safety, since some buildings still require prox access to gain entrance to those buildings. So please follow up with campus safety to add any new employees to your roster of building access. During the fall semester, meeting rooms can be used at 100% capacity, but we again ask for occupants to wipe down shared spaces after each use. Events on campus can also operate at 100% capacity, although some group events may set their own more restrictive policies, including reduced occupancy and/or mask wearing. At this time, visitors in limited group sizes are permitted on campus for recruitment events, alumni and donor events, research, for non-credit bearing courses, and for some seminars. In the fall, it is anticipated that we will begin to once again hold some of our signature events like Alumni Weekend and Family Weekend, although the number of attendees that will be allowed is still yet to be determined. At this time, all visitors must attest to being fully vaccinated or to having a negative test 72 hours prior to arrival on campus. And finally, regarding your commute, parking permits are once again available for purchase on Campus Transportation's website. While we anticipate an increased demand in parking in lieu of some folks not wanting to take public transportation, we also know that new work modalities such as hybrid and remote may also reduce the volume of parkers on a daily basis. So at this time, we have plenty of permit parking passes available, but we'll continue to evaluate parking demand through the beginning of the semester and open up other off-site surface lots at the Lakeshore campus as needed.
Thank you very much, Kana. At this time, we'd like to address a specific question that has been posed to us. This one comes from Staff Council. The question is there a plan in place if we have a COVID outbreak on campus or another shutdown? And what would be the trigger for a campus shutdown?
Right, so David spoke about our surveillance testing program, and we have a surveillance testing committee that meets weekly to monitor our campus community's positivity rate. And we look for clusters of positive cases, and we determine if we need to alter our testing program or other mitigation measures to help prevent an outbreak on our campuses. So at some point in the fall semester, if we may determine that we need to require surveillance testing of a larger percentage of our population to really understand the health of our community. We also have other levers that we can pull to help contain an outbreak before we would consider shutting down campus. So we would evaluate any other mitigation measure that we could put in place before moving to the alternative of once again going fully remote.
Great, thank you very much. And Kana, during your comments, you spoke about the activities that facilities has been engaged in. Would you please speak a little bit more about those activities that your facilities team has been engaged in over the past 15 plus months, more specifically to ensure that our buildings are safe for us to return to?
Yeah, happy to. So first, ventilation is a key and significant part of mitigating against the spread of COVID in indoor environments. We hired a mechanical engineering consultant who studied every one of our university buildings and verified that our ventilation rates, our filtration strength, and our outside air levels comply with guidance. Most importantly, modified guidance that's been set forth by the CDC, ASHRAE, and the Illinois Department of Public Health Environmental Toxicology section, specifically to help combat the spread of COVID within indoor environments. Higher efficiency filters have been purchased and installed throughout campus, And facilities continues to introduce additional outside air and increasing the turnover air in the buildings above what our standard levels are to help improve that indoor air environment. In our buildings that have high-rise, that are in our high-rise buildings, we've also installed UV filtration fans in those elevators that may have a little bit of a longer ride time to get to your to upper floors. Second, a water quality consultant was hired to help us develop a program for flushing all of our domestic water systems and for testing our drinking water. So our facility staff have been flushing our domestic water systems regularly and testing drinking water weekly to ensure compliance with acceptable within acceptable standards. And over the past 16 months, no issues have been discovered.
That's great. Thank you very much, Kana. We certainly do appreciate you walking through all of that very important work that you and your team and all the campus partners have been involved in to ready our campus for our return. So thank you very much. At this time, I would like to welcome Dan Vonderheide to the webinar. I think many of us have actually contacted a member of the ITS team over the course of the past 15 plus months, and their help has truly been invaluable. With that, Dan, can you tell us what to expect and how to prepare our technology as we return to campus?
Sure. Well, first, good afternoon, everybody. And Winifred, thank you very much for the opportunity to be here today. So as we all return to campus and we begin the process of getting our workspaces ready, I do have a few suggestions that I'd like to share just to help each of us get up and running with our, our printers, our Wi-Fi, our computers, and where to go for technical support. First and foremost, and you've heard this a couple of times today, please be patient. If it's been a while since you've used the office computer, updates likely will take a while, up to several hours. So as Kana and David have suggested, being patient with each other, we also need to be patient with the technology. For specific information regarding updates for your computer and what applications may require a little bit more hand-holding on your part, I encourage you to visit this website, luc.edu/its/tech-housekeeping. I know that they're putting that up in the chat for us right now. This website was created by Nick Libator from my team, and it's a great first and one-stop resource for all your tech needs as you come back to campus. All the tech tips that I mentioned this afternoon can be found there, and they'll go into much better detail than I am right now. Beyond your own office computer, if you have shared computers in your area or a computer in a conference room, these will also need to be updated. So while ITS is in the process of visiting the conference spaces that we're aware of and updating those machines, we ask that you please check the spaces in your areas and ensure that everything is working appropriately. If you need assistance with any of these, please reach out to the ITS service desk. We're happy to help. Contact information for the service desk is going to be on the IT, if you don't know it already, is going to be on the ITS housekeeping tech tips page. Next, your personal laptop, your smartphone, or any other mobile device you may have will need to be registered or re-registered to be able to connect to the Loyola network. We've made some progress over the last 15 months to make that process a little bit easier for you, but you'll still want to set aside some time for this activity. Again, the instruction will be found on the ITS housekeeping page. Very simple to follow. Also, when you return to your office, if you haven't been there for a long period of time, there's a good chance the batteries for your wireless keyboard, your mouse, will need to be replaced. These are typically AA batteries. So if you don't have fresh batteries in the office, you're going to probably want to bring a handful of those with you to campus. Also, if you have a LaserJet printer, you may want to consider removing the cartridges and gently shaking those just to loosen the toner so that that may have settled over time. Then you'll want to print an image or some test document just to see if the quality meets your needs and or determine if you need to replace the cartridges altogether. Slightly in a different direction, at the start of the pandemic, to get the faculty, staff, and students, functioning off campus, ITS loaned out just over 2,000 pieces of equipment. While most of that equipment has been returned, we still have a few hundred items that need to be returned in order to support our incoming students. So we have one of the device. So if you have one of these devices, the easiest way to return them is to follow the instructions once again on our back to work housekeeping page. So please visit that. So as you can probably sense, the key takeaway from at least my presentation here is for each of you to spend a few minutes looking at the tech housekeeping webpage. We'll continue to update that with new information as we kind of see common threads or common issues coming up through our service desk. We'll continue to update that page. That said, if you have any trouble getting connected, reconnected in any way, please reach out to the service desk. We are incredibly happy to serve you. We are anticipating higher call volume over the next several weeks. So, going back to the theme of, being patient, we would appreciate that, but we are there to serve you. I think that's it. Thank you.
Great. Thank you very much, Dan. We certainly do appreciate it. You talked a lot about preparing and setting our expectations for getting our computing equipment back online. Do you know about how long the computer updates can actually take?
The short answer is no, right? It's really going to depend on the computer and how long it's been since that computer's been accessed. We anticipate on the higher end that it could be as much as 3 hours. And we're finding that the application that takes the longest to load is Outlook. So a workaround for that is we're suggesting people that they go to the ITS or the LUC homepage and just drop down the link for using OA or the online version of Outlook. Additionally, if you feel that your computer is running sluggish or taking a long time to updates, we're also encouraging people to, maybe take advantage of some of the labs that are available on campuses, such as the IC at Lakeshore campus or the IC at Health Sciences or the computer lab in Corboy. These are good places to go if you just need to have access to a computer or print something. They'll be available for you, and all their updates have been done.
Great, thank you very much. And given that we will have a very new dynamic with 3 different work modalities coming together and converging at the same time, are there any recommendations from ITS on how to manage meetings where you have staff present both in the room in person and on Zoom?
Yes, that's a great question, and that's come to us through several sources. So as we return to campus, right, some of the staff will be home, some will be on campus. So we prepared some best practices, again, put on our website with tips to ensure that everyone can be engaged and participate, whether they're in the conference room or if they're joining virtually. Some of the suggestions are, just making sure that they're simple, things that we should all know of by now, but it's a nice checklist that your audio and video are on, that you can be heard clearly, to remember to share your screen so those virtually can see the documents that are being reviewed, and even consider using some of the new features or features that are out there, such as breakout rooms, and polling and so forth. So, and again, all those tips you'll find out on the tech homekeeping page.
That's wonderful. Thank you. Another round of great information for us to keep at the ready. Hopefully everybody was taking some notes and taking advantage of those helpful tips. So in closing today, we've talked about wellness. We've talked about our campus operations and the preparedness from a health and safety perspective, about vaccinations, about work modes, and we've talked about our IT computing equipment. As I mentioned at the outset, additional questions have been coming in. We've integrated as many as we can into the presentation, but we do have a full team that's working to respond to those questions as we are here live, and rest assured that if you submitted a question, it will be responded to. It may not necessarily be here today, but we're working to get to that just as fast as we can. So if you have other questions beyond the close of the webinar, please feel free to submit them on our COVID website as well, because we do want to hear from you. So from a closing perspective, thank you all very much. Thank you to our panelists for all that you've shared with us, and to each of you for participating and for your commitment toward making Loyola University Chicago an outstanding place to learn, work, and teach. As we transition back to campus, I encourage all of you to practice patience and flexibility, just as you've done these past 15+ months. And keep in mind that together we can, and together we will. Please stay safe and help others to keep safe as well. I look forward to seeing you and welcoming you back to campus. And with that, we'd like to thank you once again and wish you a good day. Thank you.